Instagram and Facebook.
Yay! Hi everyone! I'm Racquel, nurse practitioner, and we are doing some live demonstrations today. I am getting ready to do Botox and lip filler on our beautiful model, Sarah. This is her first time. She is a Botox and lip filler virgin. So if you watched my last live earlier this morning, I did some more full correction on a more mature skin patient, and now this is an example of how we use Botox and fillers in the younger generation as more of a preventative and just to give a little bit of volume. So what we're going to do today is first talk about Botox, so frown for me. So Botox is used between the brow here to prevent and correct these 11 lines. So in a younger patient, when you look in the mirror, if you are rested and you are seeing these little fine lines etch into the skin without motion, that's a great indication that it's a good time to start using Botox. So frown again for me. As you can see, she has a nice strong muscle here. This is her glabella. Without Botox, these lines will really start to etch into the skin slowly over time. And so a little bit of preventative Botox at a young age will stop you from getting those lines, smooth out your skin, and lift the brow just a little bit. So this is awesome for a younger person just as a preventative treatment. I usually recommend doing it like every 4 months, 3 times a year, just a nice low dose would be perfect for someone younger. And then a little bit of lip filler. So you have beautiful lips to begin with. And would you say you just want like a little bit of volume, a little bit of definition?
Yeah.
So we're going to use Juvederm. And filler, think volumization. So we are going to add definition, a little bit of volume, and just a little more shape to her lips. And so she has a beautiful lip shape, a little bit of an M shape, and we're just going to try to open these sides of her lips up a little bit more, show a little bit more of her lip. And so filler lasts a good year, sometimes longer, but your very first time, you might find that 9 to 12 months in, it's not gone, because a lot of people be like, oh, my filler's not lasting, it goes away. It doesn't go away, it's just that it has gone down, and then by about a year, you're ready for a touch-up. Okay, so let's get started.
How much do you usually need in the lips?
I always say just start with 1 syringe. I typically don't use more than 1 syringe in a given visit. If your desired outcome or if you need more than 1 syringe, we layer slowly over time. So 1 syringe per treatment, usually 1 syringe per year. Okay, rest your head back here for me. We're gonna do Botox first.
This person wants to know, does the filler work for both tear trough and lips?
Yes.
Can you lift mouth corners with lip filler?
Yes, you can. Okay, frown for me. Good, and then relax. Just a little pinch. So I'm using 20 units of Botox here between the brow.
And does numbing really help? It does. It's a prescription grade topical numbing cream, so it works pretty well in all areas to the face.
What do you think, Sarah? How does it feel?
It's just like a tiny little pinch. It doesn't even hurt.
If you start using Botox young in life, do you worry about resistance later in life?
As long as you're waiting at proper intervals to treat, so wait at least 3 months in between treatments, you should be totally fine. It's when people are getting frequent touch-ups too often when we worry more about resistance.
Can anyone get the lip flip?
Anyone younger for sure. Sometimes in an older woman, if the length between the nose and the lip has really gotten to be, if the lip has kind of dropped and this is elongated, we won't do the lip flip, but for most people, yes.
Maggie wants to know, can someone with fuller lips do a lip flip, or would it be too much?
Absolutely. A lip flip is, for anybody who doesn't know, is a few units of Botox above the upper lip. It's going to relax that muscle and give the illusion of a fuller upper lip. It is very subtle. So it's good for a first timer if you're not ready for filler but you want to try something. But if you're really desiring volume, you might be slightly underwhelmed with what a lip flip can do. So I say the lip flip is very subtle. It's a great option. Give it a try. It lasts 3 to 4 months. And then if you are underwhelmed, that's when you're like, okay, I really wanted the filler.
Someone said, I was told that Botox makes your muscles lazy and you're worse off than you were before if you stop.
So that's not true in this regard. So Botox relaxes muscles. That's what we're doing here. We're relaxing this muscle so she can't frown as hard, and in turn the lines will fall away. But it completely wears off. So if you quit doing Botox, eventually your muscle will begin to work hard again, and it will be just as strong as it once was. So you get right back to baseline if you stop using it.
So
Is there bruising after receiving a filler?
A lot of times, yes. So I always tell my patients, especially with lip filler, lips are super vascular. It's a tender area. I always say expect bruising and swelling for a couple of days. It's typically minor. You can throw a lipstick on, not a big deal. And then the lip filler looks good right away, but looks great at 2 weeks.
And does lip filler last as long as other areas of the face for filler?
I would say no. Lips are going to be more quick to metabolize. So lips I call a high traffic area. We're talking, we're chewing, we're moving our mouth a ton. So filler does seem to metabolize a bit faster in the lips than say something more sedentary like the under eyes. But I typically see patients get close to a year out of lip filler before they're desiring a touch-up.
Someone said, if I got Botox and still have deep creases, do I need more or do I just need to continue getting it every 3 months and the creases will eventually go away?
So probably the latter. So if you have deep creases and you're not expressing, those creases are just really settled into the skin. What you'll find is that after one treatment, they are not going to be gone. They'll be improved upon, but not gone. With consistent treatment over the course of a year, we can truly erase those lines. So you probably just need more treatment. If at 2 weeks when the Botox has taken full effect, it's still really scrunching, that's when you might consider adding more next time.
Can you explain the difference between Group A and Group B fillers? Someone asked.
So Group A fillers is going to be your thinner fillers like Juvederm, lip filler, things like that. And Group B is thicker. It's Voluma for cheeks and jawline.
Yes. So Group B is only Voluma. So everything else falls under that Juvederm umbrella in Group A.
Tool. This is just a little vibration tool, and we just use it as a distraction. So you're going to feel that vibration. It just kind of tricks your brain. So you're thinking more about that than what I'm doing.
Okay.
This person wants to know how much Botox generally costs for forehead and eyes only, but I think it's just dependent on
Depends on how
where
much
you
you
go.
need, but on average you need about, for between the eyes and forehead, about 30 units. Okay, let's open just a little for me. So this is Juvederm. This filler and all the fillers that I work with is made of hyaluronic acid. So what that means is that it's super safe. This is a naturally occurring carbohydrate in the body, and it's also 100% reversible. So I'd like to point that out for first timers, especially just knowing that if you were to have a complication, if you were to be unhappy with the result, anything like that, it actually can be dissolved. You'll never want to dissolve it, but it's just nice to know that you have that option. We have an enzyme we can inject into the filler that dissolves it right away.
And someone asked, can fillers cause inflammation even after they've worn off?
If the filler's gone, then there will be no
Right.
inflammation from the filler. While you have filler, you can have some inflammation right after your injection.
How many units of Botox are typically used on the masseter muscles?
Typically 40, 20 and 20 on each side.
Okay.
Is this painful, and did you use numbing?
Yes, so we use a prescription grade numbing cream, and it is very strong. It really takes the edge off. I'm not gonna lie, it's a little uncomfortable. The lips are tender, but with the numbing cream, it takes the edge off majorly. It's totally doable. How are you doing?
And
My eyes are just watering.
Yeah,
our
it's so
Juvederm
normal.
actually does have lidocaine in the filler as well. So as it's getting injected, it starts to numb even more.
Is teardrop filler considered Group A or Group B?
A.
The biggest thing about buying the filler, though, is you can buy whichever one, and when you come in, if we need to switch you, we can absolutely adjust that for you.
So I'm gonna do this side, and then I'll show you the difference.
Will one syringe of filler go in all at once?
Yes. 5 syringes of filler fit into 1 teaspoon. So 1 syringe of filler is just 1/5 of a teaspoon. So it's not a ton of product.
This person wants to know, is another lip question, is it good to help correct an uneven or gummy smile, or would you rather use a filler?
Botox is better for a gummy smile. If it's a true gummy smile, Botox to relax the muscle will really help. Filler can help too, just by adding volume and height to the lips. That can also help, but Botox is a great option.
And we have, can a small amount of filler be used on just one side to balance asymmetry?
Of course, yeah. Absolutely.
Is it expensive to be dissolved if you are not happy?
So my policy is that if I did the work and there's an issue or the patient is unhappy, I always extend the dissolving complimentary. If I have a patient that comes to see me with an undesirable result from another injector or somewhere else, then I obviously have to charge them for the dissolving session, and then we start over.
Someone said since she's younger with minimal wrinkles, will she still need the 30 units for forehead and glabella?
So it also just depends on the patient's anatomy, but age really doesn't matter. It's more so the condition of the skin and the severity of the wrinkling. So I would do 8 on her forehead if I was doing her forehead, so 28 units.
Someone wants to know the definition between Group A and Group B of the fillers.
So Group A is going to be your thinner filler, and Group B is for voluma. Voluma is for cheeks and jawline.
How similar is a lip flip compared to filler look-wise?
Very different. A lip flip is going to be very subtle and mostly seen when smiling. When you smile, your lip typically wants to tuck up and under and hide. So with a lip flip, the lip's going to stay open and out more. So when you smile, your lip will look a little more full. With lip filler, we are actually adding volume to the lips, so they will look a little fuller all the time.
How many syringes for a lip filler for a year would you
1
tell
to
them to buy?
2.
1 to 2.
Will her lips be
Open
sore
just-
afterwards? If so,
open
for
just a
how
little.
long?
I always think my lips are a little tender afterwards for just like a day or 2. Nothing crazy. Like you could take a little Tylenol if you needed to.
And this woman is 52 years old, and she wants to know how well Botox would work on her 11 lines if she's never had it before.
It works so well on everyone, and if you're starting in your 50s, just going in knowing realistically you're going to need to do several treatments back to back to get really awesome results. But even with just that first treatment, you're going to see improvement. It's just committing to the process and knowing that after several treatments you'll get there.
I have a good one. It
So I'm
says
going to show you guys the lips, and I'll show you too, Sarah. I want you to see one side finished. Oh my god. So if you guys want, you can get a little closer. You can see that it looks completely natural. This is half a syringe so far. The side of her lip, you can see how this is so much higher. There's more lip height, more definition. She's going to have a really beautiful Cupid's peak. And then her lips just more full and hydrated versus where we're flatter over here.
Looks amazing.
And it says, is there some cases where you would use Group A filler for places where Group B is needed, like cheeks and jawline? Or is it always Group B?
Typically in cheeks and jawline, always Group B. Rest your head back here for me.
Do you like to combine the lip flip with filler in most cases?
I do, yeah, definitely. If a patient, especially if they are really wanting a fuller lip, especially if they have wrinkling above the lip, if they have a gummy smile.
And it
the
takes
Botox is good.
2 weeks to see the full results.
Open just a little part. And then do you mind just changing this out for me? I
And-
always change my needle halfway through just to help reduce bruising and swelling. The needle dulls just a little bit, so that's what we're doing really quick.
And if anyone's confused, the lip flip is done with Botox. So some people are asking if the lip flip is a part of the open house sale. Yes, you would want to purchase our Botox special. Is there a Juvederm equivalent to Restylane for under eyes? Restylane was recommended, but I was wanting to take advantage of the sale.
Yes, we can do Volbella or Velour, which are Juvederm products in the under eye as well. Open just a little for me.
Will lip filler make the lips look like a deflated balloon when the filler wears off?
No, once the filler wears off, it's such a slow, gradual process that eventually your lips would just slowly return to baseline.
And they can do the lip flip and lip filler at the same appointment, right?
Yes.
How many syringes of filler would you need for under eye?
Typically, I start with just one, and then we have you back, and if more is desirable, do that in a separate visit.
This person asks, can it trigger a fever blister?
Yes, if you are prone to cold sores, HSV2, you want to let your injector know. I typically prophylactically treat with Valtrex, which is an antiviral medication, super safe. We'll put you on it at the time of your injection for a few days to help prevent that from happening. Any kind of stress around the mouth can trigger a cold sore, whether it's an injection, a laser.
If I have some wrinkles around my lips, would you suggest Botox or filler?
Filler.
Okay. Can you just get the bottom lip done?
Yeah, absolutely. There's definitely a ratio of top to bottom, and it's going to look a little different for everybody, but at the end it's what's going to make you happy. So a lot of times we'll look together and just kind of decide what would be aesthetically pleasing for you, and sometimes that means more or less in the top or bottom, and there are times if you have an awesome full lip that you just need your bottom.
Everyone's commenting on how beautiful it looks.
It's looking so good.
Mm-hmm.
How long does it last when you get under eye filler?
I usually say about 12 to 24 months. I have patients where it really holds up there. Open just a little for me.
Can Botox even out texture on the forehead?
Yes, absolutely.
Does filler
Definitely.
migrate?
If it's placed improperly, it technically can. In those situations, that's where it comes in handy that you can dissolve the filler. Sometimes after a long period of time, if there's some old filler left, we will dissolve that out.
Is it possible to use half a syringe?
Absolutely. So what you'll find is that to do lips, it's gonna take at least half, if not 3/4. Any less than that, it's kind of hard to achieve results. So with that last little bit you had left in your syringe, because a syringe needs to be used in one visit, it has to be discarded. You can absolutely take anything you had left, just like a tiny little pop in the cheeks, a tiny little pop in the chin, just to kind of balance facial symmetry. One syringe is not a lot of product. 5 syringes fit in a teaspoon, so 1/5 of a teaspoon is 1 syringe.
How often do you need to get Botox for the lip flip?
Every 3 to 4 months.
Oh, this is a really great question. Do you need to dissolve the leftover filler after a year when you're ready for another fill?
No. Typically, there's just a little foundational amount of filler left in there, which is actually good. It kind of has that cumulative effect, so it gives you a really good base for your next round of filler. So as long as the filler is still looking great and it's still within the lip borders and everything is nice, then we just layer right on top of that.
And how long does the lip filler usually last?
On average, lip filler lasts about 1 year before a touch-up is desired. Even at a year, it's not completely gone, but usually at about a year, you're ready for a little touch-up.
Do the lip injections happen to help with dry lips?
Absolutely. So this filler is made of hyaluronic acid, which is extremely hydrophilic, so it's going to pull water inside of your lips. So you will definitely see just naturally more hydrated lips after this.
And then someone's asking, when they're purchasing online for their lips, do I just buy one? I can't tell if you're buying units or what. Units are just Botox. So online it's for one syringe of filler.
1 syringe of filler, yep.
Can you get filler and Botox while breastfeeding?
That's a very gray area, but the technical textbook answer is no, you should wait until you're finished.
Does the filler damage your lips?
No, it does not. We're just adding a little extra volume that slowly goes away over time back to baseline.
Does the filler expand?
A little bit. So over the first 2 weeks, what you'll find is that your lips actually, the reason I say filler is good right away, but great in 2 weeks, is because the filler is settling. So what you'll see is that right when you get the filler done, it's a little rigid, a little hard, maybe even a little lumpy bumpy. And then after 2 weeks, I would say it's great because the filler is softer, it's more smooth. Over those first 2 weeks, the filler is integrating within the tissue and it's pulling water into it, that hydrophilic property. And so in 2 weeks, you'll notice that the filler is super soft, almost undetectable, just much more fluid looking.
Do you have to use all of your filler at once?
Yes. Yes, these are single dose vials. So for once you open a syringe, open it to air, it's technically contaminated at that point. So just for your patient safety, we need to use it all in one visit, But like I said, 1 syringe is plenty for 1 visit.
For lines directly beneath the eyes, do you recommend Botox to the crow's feet or under eye filler? I'm 24 and can't tell if it's from hollowness or crow's feet.
I would suggest emailing my coordinator, Jenny Brader, jenny@nyac.net, and sending us some photos, and we can take a look for you.
Do you have to have a consultation appointment before the actual filler appointment, or can it be done in one day? This person's going to be coming from Dexter, Missouri.
All done in 1 day. I have a lot of patients from Dexter. Okay, open just a little for me. Okay, close.
Can you use Voluma for tear troughs?
You can. It's not my #1 product of choice. I typically will do Volbella or Velour.
If you already have full lips, is the risk of looking too ducky or have duck lips a possibility?
With lip filler, it's the product selection and injector technique is everything. So even with full lips, filler can be done and it can look beautiful. It can look natural, it can look subtle. It's all about just kind of being on the same page with your injector, with your goals, your anatomy. It all differs from person to person. This is definitely not a cookie cutter treatment. Lips are very technical, lips are very personal. So I have injected the teeniest, tiniest lips and then the biggest, fullest lips just to give, that little extra bit of definition, border hydration. So lip filler really can be for everyone.
How and what do I buy for my lips, jawline, cheeks, and forehead?
Lips would be 1 syringe of Juvederm. Jawline would be 2 Voluma. And then forehead would be Botox, 20 to 30 units.
Are there any specials on the CO2 laser for under your eyes?
No specials on that, but it is an amazing treatment.
Can you add more definition to the Cupid's bow with this?
Absolutely. 100%.
And if I do not use all the filler for my tear troughs, can I use the rest in my lips with the same syringe?
Yes.
Will scar tissue in the lips affect filler results?
It can. There's a way to fill around scar tissue.
Racquel, what is your favorite treatment to perform?
Botox and filler, for sure. It's instant gratification. It's so fun. Okay, girlfriend, we are done. We'll just a little picture, a little pressure right here. I just think it's honestly probably one of the biggest bang for your buck treatments because it's going to give you instant results that are very long term. So injectables are just going to help you age more gracefully over the long haul.
What are some of the popular places that people get filler?
Filler can be used anywhere where we see volume loss. I talked about that earlier today. Really starting in our 20s, and sometimes we're even just born that way. It can be just a genetic predisposition if you're born with super hollow under eyes. But with the aging process starting in our 20s, we lose good fat in the face. So our cheeks, we have these awesome fat pads, our malar fat pads. Everything just starts to kind of atrophy and thin out. And as we lose fat in the face, you'll notice as you age that you're starting to see more laxity in the lower face. The folds are getting heavier. I mean, she's a perfect 20-year-old, but she has no laxity. But as we lose volume, everything just kind of drops. So what we do with filler is we restore that volume. We use it in the cheeks to kind of fill up. We can use it under the eyes. We can do lips. We can do jawline. And so with your last little bit, I'm actually just going to pop just a little in your chin. The rest of your head back here.
This person wants to know, does the filler open house special enough for the year supply for my lips?
1 syringe should be good.
Thank you for doing these demos, she says.
Oh, thank you.
Does the filler fill the lines, creases above your lips?
Yes, it definitely helps. Definitely helps.
Someone said if your lips are already full and you like their shape but feel like they're wrinkled, what would you recommend?
A little filler, just to add a little. Wrinkling is a loss of volume. So if they're a little wrinkled, they're just a little empty. And so adding a little filler into that space is just going to fill them out a little bit. So I don't know if you can tell, but just that little bit into her chin just helps balance her whole perioral region.
Someone said, I had a little cheek filler a few months ago. How soon can I get more?
That looks so good.
They look gorgeous.
So with lips, I always prepare all of my patients, expect some swelling. especially the next day. Usually after the first night's sleep, you're gonna wake up and your lips are gonna be a little full. And I always tell my patients, this is the stage of healing. You're gonna see your lips for the very first time you have filler, and you're gonna be like, wow, they're great, but they're big. They're gonna feel so big to you, especially due to the fact that they're numb, they're all pumped up and inflamed. Then for the next couple days, as the swelling increases for the first 48 hours, you're kind of a little bit panicked. You're looking in the mirror and you're like, I like them, but they're kind of big. I don't know, maybe we did too much. And then by day 3, 4, 5, the swelling is going down, the filler is settling in, and you're like, okay, yeah, I'm loving this. And then typically by like day 10, you're like, I totally should have done more. You know, every single time, like 99% of the
This girl wants to know, how do I talk to my husband into getting Botox?
For him or for you?
I don't know.
Because I say if it's for, I get asked that a lot by women, like, oh, my husband doesn't support it, or my boyfriend doesn't like it. And usually it honestly comes down to lack of education on it. Like, they're seeing something crazy on TV, or they're seeing a crazy person in their life and thinking that that's what Botox is. And so if you can somehow educate them on like what it really is, and that maybe point out someone in your life who looks normal and beautiful and let them know that they have it, or just kind of give them some education on what it is and how it works. Most of the time, when someone gets Botox and their husband sees it, if they were previously against it, they're like, oh, that's Botox, you look great. That's great.
Yes, you can use ice too afterwards.
Yeah, so post-care instructions, what I'm going to do is send you with a little ice pack. So you want to ice your lips 10 minutes at a time, really for like the first 24 hours. And like tonight, when you finally sit down, watch some TV, just ice really well. And then what you want to do is try to drink a lot of water, stay hydrated, and also if you sleep slightly elevated on your back, that's another tip for helping with swelling. I also give my patients a little bromelain or arnica montana, and those are homeopathic supplements that help reduce swelling and bruising in the body, so we have you try that for a couple days as well.
Someone asked if they could take ibuprofen to help with swelling after the injection.
You can take it afterwards, just not, if you take it before, you're likely to bruise and swell more. Okay, are you ready for the big reveal?
Oh my god. Oh, that's so crazy.
What do you
They
think?
look amazing.
Aww.
Oh, thank you.
You're welcome. Let me see. Okay. Okay, so look at the camera. So we'll look straight on and then smile for me. And then relax. Perfect. Good
Alrighty.
job.
Thank you everyone for
Thank
tuning
you.
in.
Thank you for tuning in, everyone.
If you have questions, please text 314-991-5438.
Do you want to share
Thank
this on
you.
your IGTV?
Should I?
This is good.